When it comes to diagnosing rabies, the limitations of current diagnostic tools make it challenging to detect before clinical disease onset. Clinical diagnosis is difficult unless specific symptoms like hydrophobia or aerophobia are present, or there is a reliable history of contact with a suspected or confirmed rabid animal. To better understand the diagnostic techniques, it's important to have a brief overview of what rabies is. The rabies virus belongs to the Lyssavirus genus and Rhabdoviridae family. It has a bullet-shaped appearance that spans 180 nanometers in length and 80 nanometers in width. The virus has a single-stranded, negative-sense RNA genome that is surrounded by an envelope. There are different species of the virus, which include rabies virus, Lagos bat virus, Mokola virus, Duvenhage virus, European bat Lyssavirus, and the Australian bat Lyssavirus. Now let's briefly take a look at the disease caused by the rabies virus. Rabies is a fatal disease that can be prevented through vaccination, but once symptoms manifest, it is almost always fatal. Domestic dogs are responsible for up to 99% of human rabies cases, making it a zoonotic disease. Rabies is considered one of the neglected tropical diseases and primarily affects marginalized, impoverished, and vulnerable populations. The disease manifests itself in two distinct ways, each with its own set of symptoms and outcomes. The furious type. This form is characterized by hyperactivity, excitability, hallucinations, lack of coordination, hydrophobia, fear of water, and aerophobia, fear of drafts or fresh air. Death typically occurs within a few days due to cardiorespiratory arrest. The second form, paralytic rabies, is responsible for roughly 20% of human cases and has a less dramatic, yet longer-lasting course than the furious form. It is characterized by muscle paralysis at the wound site, which gradually spreads throughout the body. Coma sets in, and the disease eventually leads to death. The paralytic form is often misdiagnosed, which contributes to its underreporting. Let us now explore the rabies diagnostic techniques in depth. Challenges regarding confirming human rabies with diagnostic techniques. Although various diagnostic techniques, such as whole virus, viral antigen, or nucleic acid detection in infected tissues, brain, skin, or saliva, can help identify human rabies during and after death, the lack of sophisticated laboratory diagnostic methods often leads to the underestimation of the true disease burden and public health impact of rabies. I will be paying attention to antemortem tests. When it comes to diagnosing rabies before death, the fluorescent antibody test, FAT, is an effective tool. It can be administered on nuchal skin biopsy and corneal smears. However, the test's reliability is limited and may have low sensitivity in suspected cases. Additionally, FAT on corneal impressions is not a standard test due to the risk of corneal scarification, particularly in encephalitis patients rather than rabies patients. Antibody testing. If a history of rabies vaccination or cerebrospinal fluid is absent, the presence of antibodies in the serum indirectly indicates a rabies infection. However, it is not that simple. Interpretation of test results can be difficult, since the host's immune response may vary from person to person. Serological testing is not ideal for antemortem diagnosis due to late seroconversion and the high mortality rate of host species. However, it may be useful in diagnosing paralytic rabies, which has a longer survival period. Serological techniques are valuable for assessing seroconversion after vaccination and for epidemiological studies. Detection of neutralizing antibodies as a possible diagnostic modality. This test has poor sensitivity in antemortem testing. However, it does have a role in monitoring immune response in rabies virus treatment. Antibody testing is crucial in monitoring the immune response in the central nervous system, which provides insight into the potential clearance of the rabies virus in patients undergoing experimental treatments like the Milwaukee Protocol. Another test, the Rapid Fluorescent Phos Inhibition Test, RFIT, is the primary method of estimating the titer of rabies virus neutralizing antibodies. However, it's cumbersome because it requires cell culture, fluorescent microscopy facilities, and biosafety measures to handle live virus as well as trained personnel. ELISA-based tests for detecting rabies enzyme-linked immunosorbent assay, ELISA, are simple, safe, and rapid alternative to RFIT for detecting rabies. However, they cannot detect neutralizing antibodies. ELISAs do not require high-containment facilities or live virus. A number of ELISA tests have been developed. Some detect rabies-specific immune complexes in CSF samples for rapid antemortem diagnosis of human rabies. Others detect glycoprotein antibodies in human serum and CSF samples. The disadvantages of ELISA tests is their lower sensitivity compared to the neutralization tests. However, newer ELISA-based methods have been developed using electrochemiluminescence to detect rabies glycoprotein antibodies in human and animal sera, have demonstrated higher sensitivity than conventional ELISA methods. Now, let us focus our attention to molecular tests. The effectiveness and limitations of real-time PCR in diagnosing rabies. A study has revealed that real-time TACMAN PCR, in conjunction with rabies viral neutralizing antibody detection in cerebrospinal fluid, achieved a 100% success rate in diagnosing rabies. However, there is a concern that viral genetic heterogeneity could result in mismatches between the target and the probe, which would consequently reduce sensitivity or lead to false negatives. Be that as it may, binding site mismatches were shown to have little impact on detection or amplification in other research studies. Other molecular tests, such as nucleic acid sequence-based amplification, NASBA, and loop-mediated isothermal amplification, LAMP, are used for rabies detection and have high sensitivity and specificity. Real-time PCR assays such as NABA and LAMP can be used for quantifying viral RNA to assess viral load, disease progression, and the efficacy of experimental therapeutic approaches, but requires stringent quality control measures. The real-time molecular assays are recommended for antemortem diagnosis of human rabies and for epidemiological surveys in laboratories. Thank you for tuning in. If you enjoyed the video, don't forget to like and subscribe to our channel.